Now we're starting. I'd like to introduce Marica Cox Mitchell, Senior Director of Early Learning, Bain and Family Foundation, to discuss building the pipeline of qualified early childhood professionals. Take it away, Marica.
And I'm going to attempt to share my screen.
No.
Okay, so thanks for being a part of this conversation. I'm going to just give you an overview of some lessons learned from the District of Columbia, and these are early lessons learned. I think when we talk about the early childhood pipeline, we often separate compensation from preparation, and for this conversation, I'm going to sort of blend it all together as I talk about what recently happened in Washington, D.C. So just some clarity, just some what. Essentially, public funding was allocated for pay equity support, our DC Council. And the funding specifically narrows the pay gap between educators who work in childcare and early childhood educators who work in public schools. 54 million was allocated in FY22, and that grows to 74 million. Again, 72 million. Again, this is exclusively for compensation of early childhood educators in what we often call the childcare sector. The parity scale is based on role, experience, and education. The implementation of this work is divided into two distinct phases. In many ways, because we needed an infrastructure to be developed to disseminate the funding. There are no existing mechanisms to get compensation from a publicly funded source into every single childcare program. And so we needed some time to build that infrastructure. And I think it's something we need to think about as we're advocating for increased investments in early childhood and explicitly for compensation. We need to start thinking about the infrastructures we need in place to support the compensation and preparation we want. So in the first phase, as we build and develop this infrastructure, funding will go directly to educators. It'll be based on role only. Educators will receive either $10,000 or $14,000, depending on their role. And again, this gives time for some infrastructure development and additional data gathering. Phase two, the funding will go to the employer for salary support, much like it is in the K-12 system, where that funding is just part of their weekly or bi-weekly salary. There's a minimum salary scale that was developed, and that salary scale is leveled by role, education, and experience. And at that point, with the infrastructure developed, we'll go into infrastructure maintenance mode. So as you can see, the conversations about role, education, experience informs the conversations about compensation. It is not effective to separate them because they're so interconnected. And I think we have lots of conversation about the need for compensation, but when we have to have conversations about comparable preparation, we tend to shy away from those conversations. But if we need comparable compensation, we're going to also have this conversation about comparable preparation. So let's talk about who's eligible. Teachers are eligible, assistant teachers are eligible, and they must work in a licensed facility. And the language here, teachers or caregivers. Caregivers is the language that's often used for our home-based programs or home providers. Who's not eligible? Public pre-K teachers, in part because they're receiving compensation parity from another source. And other professionals working in programs like directors, coaches, administrators, family engagement specialists, they're not eligible for this. Funding is explicitly for teachers and assistant teachers. And again, this includes home-based programs. So I just want to highlight just a few insights into how this happened. And again, this is not a very inclusive and comprehensive study, just again, some early lessons that I've been able to observe. I think it's important to note that this is continuity. The District of Columbia has always been progressive about early childhood policy and funding. We were a Head Start pilot in 1964. Since 1972, we've had some pre-K4 classrooms in our public schools. We certainly have public pre-K for all 3- and 4-year-olds across multiple settings. We're #1 in the nation for pre-K enrollment for 3- and 4-year-olds. And recently, with the passage of the Birth to 3 for All Act, that lays the foundation for universal childcare by focusing specifically on infants and toddlers. So I think continuity is really important as we think about policies around compensation or preparing the workforce. It's important to not disconnect it from prior wins. It just needs to be part of this continuous story. And as a result, the advocates also need to be connected and not segmented. Because I think sometimes we create too many policy tables, we lose a lot of the institutional knowledge. The context, majority of our legislature, I would say, get it. And certainly compared to Texas, the district is much smaller. We're not quite a state yet, but that's in the works. I think what's also important to note is the coalition that led this win. It included what I'll call proximity experts and policy experts. So proximity experts are those who are living the current workforce challenges and know it well. The families, the educators, and administrators, they were leading this charge. They were not simply brought in at the end as a prop for public awareness. They were at the table guiding, informing, and leading the public messages, as well as public policies. And certainly that included policy experts. I think too often we, again, bifurcate and create false binaries between who's a policy expert. And oftentimes we've seen that the proximity experts can be very effective and sometimes even more effective than our traditional policy experts in raising awareness and increasing funding. The part I think is also important to note is this idea of coherence. Like I said, in Texas right now, anything from a 24-hour training credential, training certificate to a bachelor's degree will do. That's just really hard to create a coherent case for public investments. And so what you have in DC, much like Cody described, frankly, with the ECE 1, 2, 3 framework used as part of the unifying framework for power to profession, when it came to calling out and naming the education and the role, the credentials were CDA, and that was already in our regulations, associate's and bachelor's degree. And certainly there's definitely more nuances there about degree types and alternatives to those degrees and credentials, but by and large, it was just a really clean, coherent message around credentials, and our proximity experts were aligned with that. I often say in early childhood education, sometimes we defeat our case for compensation, or we make it too murky by airing all of our laundry on Front Street. Whether you believe a degree is important or not, which credential is most valuable, your apprehension about the CDA and CDA graduates, when you're asking for compensation, that's not the time to have that conversation. So I think what worked well, again, because of the regulatory context in DC, as well as the alignment in with the coalition, they all had a united message, a unified message using the unified framework. Part of the coherence is also language. It was for early childhood education, and the individuals receiving the compensation are early childhood educators. Whether they worked in a center-based program, home-based program, we did not throw out all of the complex language out as part of the messaging. For early childhood educators, doing early childhood educations in licensed childcare, period. As you can imagine, if we start splintering and using caregivers versus providers versus Head Start teachers versus pre-K teacher, infant toddler teacher, that would have just gotten added to sort of the confusion, but the coherence definitely help with both the implementation as well as the policy making. And certainly equity was front and center. This was about equal pay for equal work, period. It was settings agnostic. There was no hierarchy between, are you in a licensed home-based program or a center-based program? Are you Head Start or Head Start? That was irrelevant. And I think, again, some of the changes we need to make as we make stronger case for compensations, that we too have to get in this sort of settings agnostic frame. When other professions ask for public investments or public attention, they don't hyper focus on where the service is being performed. I mean, we just saw nurses, for example, I'll use them as an example for many reasons, including the fact that they're a female dominated profession. They receive significant funding, particularly travel nurses. And whether they're working in a university hospital, whether their patients were paying or paying for the services using public dollars or private insurance, all of those mechanisms and settings were just not up front and center in the discourse about equal pay and equal work and heroes pay and additional compensation. So I think the settings agnostic part, it was really important and something we need to work on. And it's also an equity issue. So we should stop bifurcating and creating false hierarchy between home-based programs and center-based programs. They're all early childhood educators. Some of our early childhood educators working home-based programs have bachelor's degree. Some of our early childhood educators working center-based programs have CDAs. So in many ways, challenging those hierarchies was part of some of the equity conversations we had in DC. It also recognized the levels of preparation that the field values as valid. Again, typically in DC, because of our context, it's the CDA, an associate's degree in early childhood, or a bachelor's degree. And then allow for some equity adjustments for programs serving young children in historically marginalized communities. So I really want this to be a conversation, but I thought it'll be important to just share a little bit more about the context. And so I'll pause now to see if you all have any questions.
Hi, thank you so much for your presentation. I'm Kim with Children at Risk. I just joined, and I'm still learning a little bit more about early childhood education. But I was wondering if you could elaborate a little bit more about the infrastructure that is needed. From my current lens, I'm thinking that facilities may not have the ability or capacity to seek out these programs that could help support them. But I'd love to hear what you were thinking under that umbrella.
Sure, and that's a good point, right? The infrastructure development and time to build that is on both ends, both the government, right? Because again, think about the way in which we distribute public dollars to early childhood programs. It's not for all programs. So we either have subsidy, which goes to some programs, or public pre-K, which goes to some programs. We currently do not have a mechanism in place to get public dollars to all childcare programs. I mean, we may do grants like the recent relief dollars we're now distributing, but there isn't on the government side an established mechanism to get significant funding to all licensed programs, regardless of settings or program type. So that had to be built. And certainly on the employer side and even the individuals, right? Do you have direct deposits? Do you even know your role in your program? Is your role a teacher role or a teacher assistant role? Just clarity about the degrees, the credentials. Do you have your credential with you? Do you have a copy of your degree? Do you have a copy of your CDA? Just building their sort of capacity to frankly own their profession. I think this provides an opportunity for the educators to own their profession or professional growth. And then certainly on the employer side, just having clarity about, again, their staffing, making sure the staff records are in place, making sure they are very clear about their HR policies, and such, payments, salaries, like all of that. So, that's exactly why we had phase 1 and phase 2. Phase 1 was really important for everyone to build their infrastructure and capacity, as well as public awareness and messaging.
Thank you so much.
You're welcome.
Good morning. Hi, my name is David Cameron, and I have a question. My partners and I, we've actually addressed all these issues. We're trying to build a high-tech elementary school in Dallas, and we're looking at Fair Park as our site. And we've done a market analysis and everything. And what we're looking for is people who could partner with us or even invest with us. And so our project's gonna be over $100 million, most likely. We're looking at hosting a Bezos site for Bezos Academy for pre-K, and then we're gonna add kindergarten and 5th grade. And eventually with my partners, we have like Snoop Dogg, Dr. Dre, the DOC, the rapper, Rolando Blackman, former Dallas Mavericks players. They want to focus on building middle school and high school. Within our 5-year business plan, we plan on adding middle school and high school. So we're going to eventually do pre-K all the way up to high school and partner with all the colleges, Dallas College, SMU, et cetera. And so, and the president of my board is an African-American woman, Principal Angelia Ross, Fort Worth ISD International Newcomer Academy. A lot of her kids are refugee kids. And so we have all these people in place, but we kind of need help in terms of, because I'm in education, we're all in education. We don't have the experience in terms of establishing a 501c3, et cetera. And is that something that y'all might be interested in?
Sure. I mean, I will definitely turn you to the local advocacy organizations here. I mean, certainly Texas AEYC, Children at Risk, and others to help navigate the context, but it seems very impressive. And I think what you speak to is, at this point, I think what the pandemic show is we just need to see it. I think we talk about it, this reimagined childcare system, this reimagined early childhood education system, and it would just be great to just see it in practice. And David, I think what you're doing provides an opportunity for us to just stop talking and be about it, and actually have some demonstration sites that embody all of the essential components of a more equitable and effective system. So I applaud you for doing that. And don't forget about the infant toddlers, I'll say. And pre-K, starting at pre-K is great, but infant toddler education, particularly birth to 3, is where significant learning occurs, and sometimes we overlook that.
Thank you.
I have a question. And thank you so much for all the information that you've shared with us today. It's been very helpful. My name is Paula Miller, and I live here in Houston, Texas. And what I'm trying to find out, what you're doing is something that I definitely believe in and I support. But what I'm trying to find out, who is it that I can work with to share what I do? Because I am a, which basically all of us have, especially when you're dealing with children that's been removed from homes, placed in homes and foster cares and RTCs and things like that. And so in specializing, as being a specialist with child abuse recovery, being a specialist in child abuse recovery and stress management, I'm trying to see who could I actually work with in that aspect of that part of, because also what I do is help families and individual persons be proactive and focusing on solution, which minimizes challenges and, provides stability in one's life, helping to diffuse situations before they become a problem. So who is it that I can contact to kind of work with to go in and do some training when it comes to stress management of dealing, with the children, because a lot of that does come from dealing with kids, people not knowing how to handle them, and also, educating on child abuse itself.
Yeah, I mean, absolutely. I mean, folks on this phone probably know Texas more than I do, but I mean, just from a little bit I know, again, Texas Workforce Commission, I know they provide a lot of professional development opportunities. Local higher ed programs, including the community colleges, could be a great source. Your childcare resource and referral network, Texas AEYC are just some starters, but I'll definitely turn that question over to folks from Texas who know the landscape a lot better than I do.
Okay, thank you so much. Thank you.
Thanks, Paula. Any other questions or comments?
Marica, I was wondering if you could speak to some of the coalition building that you did with your proximity experts to kind of get everybody on the same page with that language. I know that kind of in the fractured systems, everyone wants to kind of watch out for their piece of the pie a little bit. And so I'm just wondering how you were able to, or the process for bringing everybody together to present that united voice in your articulations.
That's a really good question, Sarah. And it took time in relationship building, frankly, and trust. So a coalition was formed in 2015. I'll say for the first couple of years, and the Bainham Family Foundation, as well as others, funded that coalition, inclusive coalition. And for the first couple of years, frankly, it was all about relationship building, so that the advocates who were really focused on family childcare and fighting for their piece of the pie were able to build relationships with your AEYC counterparts in DC. The DC AEYC built trusting relationships with those who are advocating for Head Start, and all recognizing that, wait a minute, we're all challenged by this underfunded, oppressive childcare system. And so they're powering numbers. So I think it was really important just to give them the time and space to frankly build that relationship and learn each other's work. And oftentimes that time and space aren't provided. And I'll turn that frankly to funders. I think funders often will create a coalition table and just expect magically for everyone to come to that table prepared to have the conversation. Whereas part of building this coalition table with the proximity experts meant we were making sure they were prepared and supported to be at that table. So for example, everyone at the table had at least one full-time staff exclusively dedicated to that coalition building. So I'll say it takes time and money, frankly. Because once that relationship is built, then everyone can kind of see how they're sort of all connected. And I think the beauty of it right now is, so I'll use the home providers as an example. Everyone advocates for home-based programs. Typically, everyone would turn to the one advocate and to carry the weight. But now, because of the relationship and shared knowledge, everyone at the coalition table, and we're talking about more than 10, 15 organizations, are all carrying that mantle. So there are power in numbers, but it takes time for us to sort of challenge that, or the model where we're all so segmented, coming and asking policymakers our distinct questions for our distinct group, to, hey, maybe we should just all band together and have one crisp and coherent ask. But Sarah, it took time and money. And
I'm thinking back to the graphic that Kim shared at the beginning with some of the reasons that early childhood educators may not pursue additional degrees or credentials beyond their high school diploma. And time and money, man, it's everything.
Absolutely, yeah. And so we've created the conditions that, frankly, in many ways penalizes those who are getting their degrees and credentials. So in many ways, again, the penalty is higher for those who are getting increased credentials. The penalty is higher for those who are trying to meet the highest standards, maybe it accreditation or a quality rating and improvement system. So in many ways, the current system disincentivizes quality versus rewarding and incentivizing quality.
I'm curious, so what are some of the changes you've seen in your 18+ years in early childhood education?
Certainly visibility. I often tease that when I first became an early childhood educator, decided to become an early childhood educator, to see a story on early childhood education or childcare, as is often mentioned in public media. We were like a small article clipping kind of near the obituary section. And now fast forward, I think everyone is catching up to what we always knew to be true, catching up to the signs, understanding how important early childhood educators are for powering the economy. And so we're definitely getting increased visibility. And with that increased visibility is going to come increased accountability. certainly increase funding, but it's come with increased accountability for our practice.
Has there been any recent developments that have kind of energized you or excited you about the movement within our ECE workforce?
Yes, definitely, seeing, while we definitely need federal investments, want to make that clear, but seeing local communities like the District of Columbia, the state of Rhode Island, and others, New Mexico, and others sort of take the charge to see what can we do with what we have while we still make the case for increased federal investment is really exciting. I think it's also interesting and important to sort of look at history. Historically, we have had some early childhood wins during a crisis. A crisis occurred, public awareness increased, and public investments increased. So I'm also wondering if this is one of those scenarios where, because of the health pandemic, awareness is increasing, and how do we ensure public dollars increase, and not just increase, but increase and go to where the need is greatest. I'll actually flip that question and ask, because I'm also curious to learn from the folks from Texas. Like, what makes you hopeful? Like, what are some bright spots that makes you hopeful about building this pipeline, which requires preparation and compensation?
I think that I'm excited about some of the increased funding that we're still seeing as a result of the COVID pandemic. I mean, the fact that Texas is getting billions with a B in dollars to spend on childcare and early care, like, is fabulous. I think just here at Texas AYC, we've seen a big increase in our funding for the TEACH program to be able to help offer those credentials and degrees. So that's a great place for anyone who wants to get started on continuing their education in that way. And then I think, some of the conversations always take a long time, but some of the conversations that are still moving, maybe not as fast as we want them to, but about things like quality and about things like being able to do more with our Texas Rising Star system and our subsidy programs to really provide the high quality care to children across Texas.
Absolutely.
I would say I'm excited about the support specifically for providers. Like, when we did our Quest for Equity report, we kind of mentioned that the providers mentioned that because of the pandemic, it's harder to communicate with each other, network with each other, to kind of understand how it works. So I'm excited to see as that grows and more providers kind of get together and help each other on stuff that seems confusing and hard, kind of like the TRS, how to do paperwork and stuff like that. So that's exciting to see.
Yeah, absolutely. I think, as you mentioned, paperwork, it just makes me think about the administrative burden that often we hear providers talk about, how they definitely are interested in increasing equality in serving through the subsidy system or the Head Start system, but find that the administrative burden is too heavy to bear and frankly doesn't have enough return on the investment. So I'm glad you're looking at that as well.
For myself, as a coach from Texas School Ready, I'm excited to just, now that we started the coaching birth and toddler teachers too, just seeing the impact of just this year alone, the growth in my own teachers and them seeing the growth in their own children and in ways that they didn't think it was possible. And I think they're really excited to see how much just learning a few best practices has changed their classroom. So I'm excited for that upcoming more research and more evidence that proves that how important it is to have programs that start from the very beginning.
Absolutely, Carol. And I think you're right. Sometimes we focus for policy expediency sake. We always focus on pre-K and we forget our infants and toddlers. But focusing on early childhood educators who work with infants and toddlers is really important. And as you've shown, once we support the educators themselves with their ongoing professional development needs, coaching their practice, we can see increases in their both their professional practice as well as just professional pride. And thanks for sharing the resource, Carol, from Texas School Ready. Any other questions or comments? Do we have any higher ed faculty on the call? I'm just curious. Or are they all with articulation conversation, I imagine?
I was just about to say, I bet they're all in that other room. Gonna catch this on the replay.
I'll say something in defense of higher ed, and again, it's gonna go back to the quality and coherence. I think sometimes we forget that higher education is a part of the profession. We have all of this, we have low funding, lack of investments, harsh working conditions, and we assume that incoherence, right? Fragmentation, extreme variation, and we expect higher education to just be perfect, when frankly, they are a part of the profession, and all the challenges that happen in early childhood program, they're essentially mirroring it. And so I think it's really important to certainly hold higher education accountable for preparing competent early childhood educators, but also recognize that they too mirror some of the inequities and barriers that the early childhood educators are experiencing in early learning programs.
And I believe we are meant to join back in the main room. So we'll see you in the back over there.
Thank you for the conversation.